Hello, welcome. This is the simple difference between bone and cartilage. For bone, term osteo is used, and for cartilage, term chondro is used. Bone are actually more rigid and hard connective tissue, while cartilage are less rigid and flexible connective tissue. So one thing is common between these two, both are type of connective tissue. Both are actually hard connective tissue, but bone is comparatively more rigid, more hard because it contains calcium phosphate, while cartilage is less rigid and somewhat flexible type connective tissue because it do not have calcium phosphate. So bone are more rigid and hard connective tissue, cartilage is less rigid and hard connective tissue. Bone are actually living and they can grow, while cartilage is non-living and it can't grow. Bone have calcium phosphate deposition, while cartilage do not have calcium phosphate deposition. Bone have blood supply, while cartilage do not have blood supply. Bone cell are divided into three categories. Osteoblast, these are bone forming cell. Osteocyte, mature bone cell. And osteoclast are actually bone dissolving cell that digest or phagocytose bone or cartilage. While cartilage cells are called chondrocyte, must remember that cartilage in general is non-living, but it contains some living cells that secrete cartilage. The living cells of cartilage are actually referred as chondrocyte. There are three different type of cartilage: hyaline cartilage, fibrocartilage, and elastic cartilage. Hyaline cartilage is most abundant one. It is present at end of joint, at end of bone in joint, and involved in formation of joint. Fibrocartilage actually it form your uh, vocal cord. These are actually form of fibrocartilage. Elastic cartilage is also involved in formation of ear, pinna, and like some part of your nose. So this is some a little detail about bone versus cartilage. See you again after a short break. Fi amanillah.